Thank you for coming and joining us again here on our Friday features here on YouTube and on our website. Please don't forget to subscribe and share this video with others. We welcome Dr. Lorna Savekovich and Dr. John Brachowski here this week, and we're talking about fertility and how do we treat fertility and what are really our options these days, and that are really in line with our faith and what are the struggles that women do have as they tackle their issues of fertility. Thank you both, honestly, for joining us here again Friday for our Friday features. This has been kind of a following as we're gaining some momentum here and really tackling a lot of different issues. And fertility is one of those that may be kind of an unsung hero. You know, it's kind of that quiet, sad story in a couple's relationship where they're struggling. They desperately would love to have a child, or their family has been, maybe they've only been fortunate to have one child, but they would love to have a larger family. But you see and work with that on a very regular basis, Dr. Lorna.
Sure.
Tell us a little bit about how often or the frequency would you say that this comes up?
Well, in the overall population now, it's 15% of all couples are afflicted by infertility, either subfertility or, pretty much total infertility. So that's not rare at all. And I think also the issue has kind of come out of the closet with IVF and with all the advances that have been made. So, it's not, I think it's rare that you see a couple that goes more than a year or a couple of years without getting pregnant and doesn't become evaluated, which is quite different from years ago. I see many couples now, many women now who are in their 60s or 70s, and I ask them, well, did you ever try to find out why you didn't get pregnant? And they say, no, we just decided not to, or they either thought maybe there wasn't much to offer. So that does not occur these days at all. I was going to say it's almost the opposite. People get married, and then sometimes I have people who are coming in at 6 months and wanting to know why they're not pregnant. So it's kind of almost segued to the other extreme.
Yeah, I agree. I think that for so long, and it was interesting, if you listen to Lorna's words very closely, why did you not get pregnant? So infertility or fertility is a desire. It's this desire to have a child. And for up until we took a different look at it, children, at least in my residency, children were sexually transmitted diseases, and we were going to try to stamp out fertility at every possible moment. I went to a contraceptive research and development center. So every time you keep people contracepted, and then you only allow them their fertility when they want it, and then shut them back off again. So it's more like a car and a mechanic, very mechanistic. And for us, and Lorna was the one 30 years ago, believe it or not, we're both only 45 right now, but 30 years ago, Lorna was the one that got me realizing that fertility is part of your natural health. You cooperate with fertility. And infertility is a desire. So what she said beautifully was, what is the cause? And so now here at the Tepeyac OBGYN, we're trying to address the causes of infertility, rather than looking at you like you're just parts, sperm, eggs, hormones, what have you, trying to take a holistic approach. And it is more common these days, and finding those causes, right, of the 1 in 8 is really what we try to do here to the best of our ability.
So you get a couple comes in and they're struggling, they want to have a baby. You're assessing, you're evaluating. What are some of the traditional options that you found very effective to use? I know it's probably different for every patient that comes in, but what do you tend to work with? Is it just a Creighton, or is it Billings, or who do you guys?
Well, I think the goal, as John said, the goal of the evaluation is to figure out why they're not getting pregnant. So that involves two sides of the coin, the male and the female. So in the female, a total evaluation involves looking at her hormonal status, the status of her reproductive organs, and whether she has any diseases associated with any of those two things. Then on the male side, it also has to do with the reproductive organs and their hormonal milieu. So first of all, we start out with the woman and we look at her charting, because that really is an indirect reflection of everything that's going on throughout the cycle. We do targeted hormone tests using the charting as a base to tell us when to bring them in for testing. Because since the hormones go up and down, unless you know when ovulation is, any given hormone lab value is indecipherable unless you know when ovulation was. Then we do testing to make sure her tubes are open. We do testing to make sure the uterine lining is normal and the uterus looks normal, no fibroids, no adenomyosis. Ultimately, we do laparoscopy to rule out endometriosis, which is, I think, the thing that makes my evaluation quite different from what you would get from an infertility clinic, because with the onset of, or with the evolution of IVF, reproductive endocrinologists have kind of put endometriosis by the wayside, because they know they don't have to treat it necessarily to achieve their objective, which is a pregnancy. If you're not going to do IVF, though, however, you do have to treat it in order to achieve a pregnancy. So on the male side, we do a seminal fluid analysis where the specimen is taken at home during a normal intercourse, and then we proceed from there. That's a pretty total evaluation.
And I can just tell you, just this morning, I saw a lady who had one baby through IVF, and her last 2 attempts had failed, and she's now come to us because she's beginning to discern that the embryos she's collected or made were more her children than her property. And she came to us because she heard about Dr. Lorna's work. And so I had a chance to see her today, and I started talking to her about exactly what she was just saying, this holistic approach. She shuddered and she says, I've been doing this for 2 years, and no one has ever asked to look at my hormones or ask me about, and then they just simply had my husband do things that he didn't want to do to collect his counts, his sperm. And lo and behold, she was just so grateful today. Now, we talked about the child, but it was also about health and fertility, meaning there's so much more you can find out. And when I told her about a laparoscope to look for endo, she kind of went, "Excuse me?" It wasn't even brought up.
No.
And when she said, as she's leaving today, she just said, and once again, she's not a believer, there's nothing, she's just a nice, normal 35-year-old. She goes, "Thank you for looking at me holistically or integratedly." And I really think that that's the difference of what Lorna and I secondarily do here, is that it's a integrated whole way to approach the underlying causes and then trying to correct those or improve those to the best we can. And being knowledgeable and just being scientifically, evidence-based.
Yeah. You'd mentioned something, and maybe you could repeat it for me, but why don't other secular practices who are trying to deal with fertility, maybe it's through IVF or others, why don't they use some of the same methodologies that you're using?
I think the main reason is that they can achieve, simply with the technique of IVF alone, they can achieve their goal. And that's really what they're looking for, is the goal of a pregnancy, of a full-term pregnancy. Whereas we certainly have that as a goal, but it's not the only goal. The main goal is healing. And if that results in a pregnancy, then that's what we want.
Seems very rudimentary, if the main goal is healing here, but
Exactly.
that's not the case all the time.
And that's why technology has kind of overtaken not just infertility evaluation, but medicine, I think, in general.
Right. And I just got back from a conference where you can show that this approach to healthcare, to the infertile couple, the desire to have a child, is actually cost effective, is actually less. The biggest side effect of IVF is twins and triplets, which have a much higher monetary and suffering value because of the early preterm births. Well, in the way we approach it, we don't have that side effect. And this idea of, we don't have the side effect of the mother who has 11 or 12 embryos frozen in the concentration cans, I call them, around the country. It's a real challenge. I also think it's money. I think if you're looking at $10,000 to $20,000 a pop for an IVF cycle, they're now saying that no, they don't want to do twins and triplets, so now they're doing single embryo transfers. And now the original pioneers of the IVF movement are now saying, what is always most expensive is not maybe always the best. And they're beginning to look at the things we've been doing for a long time. Progesterone supplementation. You know, what is that about? When I was in my IVF days, we looked at fertile cervical mucus on every one of our patients. The grounding of what we're doing with our charting.
Yeah.
That's the beauty of it.
Well, it's funny. I look at, just like you said, technology is what it is. It's infiltrated medicine. It's getting away from the actual care and listening to a patient. It's the Google world that we live in today, right? I want that instant. I want to know right away. And with IVF, I don't know if it's any faster. Do you find out whether it's successful or not, or maybe it just has a higher successful rate, but yet at the same time, it's
Well,
not
it's
going
certainly
along with
faster. I mean, in the beginning, IVF was primarily used for male infertility and tubal infertility. And certainly it's faster for that, because with tubal infertility, you're probably not going to ever achieve a pregnancy with natural methods, because you have to have tubes to put the gametes together. With male infertility, however, if you're persistent and over time, you may achieve a pregnancy, whereas if you do it IVF-wise, it's in one cycle or two. So,
And what we learn a lot of the times is, like, even when we're counseling our women who are contemplating ending a pregnancy, it takes time. Just like the morning sickness that makes us want to not have children even when we're pregnant, it goes away in a few weeks. And this idea that even though there's a little bit more time spent, it allows the person's psyche and her physiology to get caught up, and it allows us to treat the underlying hypothyroidism or the underlying luteal phase defect. And over time, she and her husband can maybe talk about those issues.
Yeah.
And also get away from, I want it fast. Because that's part of the problems we're having today, right?
Everything's transactional, not really.
I hit the button and I want it now.
Yeah. That's a really great point. I do think we live in that transactional world, and everything has got to be quick and immediate. And a good couple in their marriage, that's not what it is.
And
it's not a transaction.
Right. But the other thing that she said very clearly was, when we ask you to chart your cycle for 3 cycles, it's the language of your body.
right.
Because when you go to these other places, do it on day 22, do it on day 3, do it on day whatever. That's based on a generic platonic cycle.
Yeah.
What we try to do is that Miss Jane has a different cycle than her sister, Miss Isabel, who then has a different cycle than Miss Brittany. And those languages of your body speak differently with all 3 of those. And so we're trying to drill down, like she said, we're not as effective as partners in your care if you don't know the language of your body. And if you've been conscious...
Charting is really big then.
Well,
really big
it is. And it's just to help us know the timing of what Dr. Lornak talked about.
Right. Well, and it's sort of an in-your-face reality of what is, because I think our technology sort of takes us beyond to what could be and divorces us from what is. And I think even then the couple who doesn't get pregnant, which can happen with IVF too, they have more of an acceptance of that reality.
And there are many
When they're
good studies out there that show that it is comparable effectiveness rates, in many subpopulations.
Tell me about some of the success cases that you've had. Maybe, I think you alluded a little bit to it before, that women are coming to you maybe, postmenopausal and wondering, never having been able to have a child, but while the woman is fertile, what was some of the older cases, or how old was your oldest success case?
You mean the woman who was the oldest when she got pregnant?
Yeah.
Or maybe the hardest case.
Yeah, the hardest case. Either one.
Well, I do remember a case from when I was at the Paul VI Institute of a couple who had been trying for 19 years. 19 years before they achieved a pregnancy.
Wow.
Yeah, that's pretty awesome.
Yeah.
And so, I mean, one patient that I always remember is a woman that I did surgery on twice, and really things didn't look very good. So she didn't have a great potential for getting pregnant. She had very bad endometriosis, which we did major surgery on twice. She went for 5 or 6 years without getting pregnant. She then adopted a baby in December, only to conceive in January. So that doesn't mean that the adoption had anything to do with the conception, but it just means that with patience and with the right treatment, often, pregnancies do occur, even when you think they're not going to.
I know myself, I've seen many, many patients who are pregnant within several months of after Dr. Lorna has done some of her laser laparoscopy, going after the first, second, and third generation markers inside your abdomen with her laser for endometriosis. Within a few cycles after that, they're pregnant.
Yeah, it happens.
We see a lot of folks here when we treat the underlying PCOS, their cycles improve, their ability to function because you're affecting the insulin receptor, they get pregnant. There's times when we look at your hormonal level, and I can't tell you the number of times that I believe, whether we're using the basic ovulating agents, but also just good progesterone therapy, and constantly having Lorna remind us, and us reminding each other, no, give it a shot. It's very low risk, it's got a high, and you begin to see people. The other thing that comes to my mind is a young lady who had 3 miscarriages. Now, once again, there's infertility where you don't ever get pregnant, and then there's these others where they're losing babies a lot. And by looking at the whole person, yes, balancing out her thyroid, getting rid of her thyroid cancer that was there. This particular person that I'm thinking of now has 5 children. And so it's both science, it's both the surgery as well as the medicine. And looking at hormones is very important for all of us. Yeah. Those are some cases that come to mind.
Well, it's really fascinating work. I really think, like I said from the outset, that I think it's one of those types of incidents that it just, I think the couple maybe feel lost. They're not sure what they can do and who to turn to, and
Right.
and if they are faithful and they don't want to go down the IVF path. But I think the other thing that I've learned today in our conversation is that going this natural way where you're not going IVF, you really get a better picture of the true health of the patient, of the woman. And that's really what you're trying to get to the core.
Right. Well, and, IVF is certainly not the end-all and be-all. There are people who fail IVF.
Most.
These days it's getting better and better and better, and that's why it's kind of hard for people to not go after it, because it is getting better. But I think there are very few people who won't get pregnant, who will never get pregnant without IVF. And primarily those are with very severe male factor or tubal. They just don't have any fallopian tubes. Well, that's a tiny percentage of the whole infertility, group. So most of them with, less technological means can get pregnant in a more easy and less expensive way.
So the lady this morning that I told you about who had the one child 25 months ago with IVF, she's now suffering the challenges of, she had 2 failed cycles after that, and all these embryos that were made in the process. As a mother, she's really having second and third and fourth thoughts, not sleeping well, beginning to realize what had happened. The other lady that I saw this morning was one of ours, again, a young woman from the Middle East who has been here in this country for 20 years. I want to say 11 months after her initial treatment with us, she's now pregnant with a 8-week-old baby, unborn child in her. And the smile on her face, and all she said, and oh, by the way, my PMS got better in the meantime, and I didn't have to do anything that I just couldn't live with. And to see that smile, and then to see the smile in the other woman who was just grateful for us looking at the whole person, which is what the docs here, which we all try to do, was quite unsettling almost, in the sense of joyous, but you see 2 different approaches, one that has a trail of really difficult stuff, and the other woman who suffered from the same length of infertility, but it was a different path was taken.
And there's this side.
Correct.
well, psychological side effects
Yeah,
of
yeah.
that too as well, the weight of that.
But
Well,
thank
again,
you all.
I want to thank both of you for your time today, and really thank you for all you do for women who in couples who are really struggling with fertility. So, again, if you could like and share and subscribe on YouTube, and really get the word out there. Divine Mercy Care and Tepeyac OBGYN. Thank you, doctors.
Thank you.